Hello, this is my biology presentation. I chose to do it on depression. Whenever I go into the medical field, I plan on going into psychiatry specifically, psychiatrics in some way, whether as a psychiatric nurse or as a psychiatrist, psychologist, etc. So I decided to take this sort of open opportunity to learn more about something that's really going to help me moving forward. So I decided to brush up on my knowledge of depression. So I hope you find this very informative and thorough. So, to start with a little background for depression, depression is the most common mental illness with the largest amount of people that are actually diagnosed with clinical depression in its various forms. And despite what many people think, depression is far more than a simple feeling of sadness. It's a prolonged state of severe low mood coupled with altered brain chemistry. So, in layman's terms, this is a very long state of being extremely, like more than sad, being extremely unmotivated, being depressed for months and months at a time. This typically to be classified for specific forms of depression, it'll have to be at least a year in some cases. So, it's a lot more than just feeling sad for a few days. And it'll also alter your actual brain chemistry, so cover a bit more on that later. Depression can be caused or worsened by hormonal factors as well. So, as such, depression is more common in women and men, although as both groups age, this gender difference becomes a lot less pronounced, with the adult rates of depression being a lot higher in general, regardless of gender. Although it is a lot common in younger females, although it is believed that it may actually be just as common, if not more common, in children and teens. The problem being that a lot of these cases will go undiagnosed because children and teens develop so quickly that they'll go from stage to stage, that it'll seem like their personality and moods are shifting so much already that it's believed that many parents or even the individuals themselves will simply attribute the symptoms of their depression to this changing of mood when it is in fact a mental condition that needs treatment. So depression is often thought to be the result of the biochemistry of the brain going awry, but in reality the truth is much more complex. There are many causes for depression, including genetic predisposition. Many people believe that depending on your genetics, you could be a lot more predisposed to getting depression. And this connects in with a lot of the neurological reasonings, like the neurological impacts of it end up being a lot of neurotransmitters are lessened, neurological pathways can be hampered or even damaged. So if these pathways, or if there aren't enough of these chemicals, then you would be much more inclined to have these sort of negative thoughts, which coupled together would make depression. So a lot of researchers believe, pretty logically, I think, that you can have a genetic predisposition for it. So if the genes of your brain decide to write not enough serotonin, for instance, then you'll need SSRIs, serotonin reuptake inhibitors, to help with that. So then there's also medications. Certain medications can have the side effects of dampening these neurotransmitters, which can make you depressed. Stressful or emotional life events can very seriously affect your mood, which will then affect your entire brain chemistry. And also various medical problems can manifest as depression or various mood disorders. The one thing that all scientists agree on, though, is that the root of depression lies in the brain. So depression is thought to definitely be neurological in nature. So something with the nerves of the brain are really coming together to make a lot of these problems. And not to mention, your brain is where all of your emotions, all of your thoughts and feelings are stored. So clearly there has to be something going on in the brain, at least mixed in with these thoughts and emotions, to make this state. Depression is also never truly cured, though. A relapse can happen at any time if the illness is left untreated and someone sort of sinks back into their old habits. there's still a great amount of debate and research in the medical field in regards to depression, its causes, its treatments, and all of that. So, depression and the brain. The majority of depression's effects on the brain manifests in the brain's unique biochemistry, specifically the neurotransmitters. These neurotransmitters, when kept in homeostasis, really help your body and all of its emotions, all of its standard functions operate properly. So whenever you throw out this specific neurological homeostasis, a lot of bad things can happen. Specifically with depression, what mainly happens, especially the neurotransmitters are affected, are serotonin, which helps regulate your sleep, your appetite, and mood, and it inhibits pain. This is why various forms of depression will have either insomnia or oversleep because you don't have the proper levels of serotonin. Dopamine, the pleasure chemical, is also responsible for feelings of ecstasy or joy and is the sort of reward center. This sort of helps encourage you to commit or to make better choices, reinforcing those good feelings. So if you don't have enough of this, it's very easy to sink into addiction, depression, and these sort of things. So depression can really worsen these symptoms. And then there's gamma aminobutyric acid. This is a neurotransmitter inhibitor that helps quell or prevent anxiety by sort of not letting as many signals travel through your neurons, travel through from the axons to the actual nerve centers and everything. So by dampening these signals, your your nerves sort of can't freak out as much. They can't get overexcited, which is what anxiety typically ends up being, is an overexcitement of the nerves. So by sort of dampening this, you can help with the anxiety symptoms of it. There's a whole host of other ones, kind of don't even really have time. It'd be a whole 10-minute thing itself to cover all of the neurotransmitters, so that is just a brief overview of some of the more important ones. Depression is also thought, though, to affect the nerve pathways themselves. So the pathways from dendrites to axons to the brain center to the amygdala, thalamus, all of that is connected by nerve pathways. So all of these nerve pathways are also insulated by cerebrospinal fluid in some points and the various neurotransmitters. So whenever these neurotransmitters are thrown out of whack and the homeostasis is lost, you can easily see how signals wouldn't be getting around, and it's easy for things like sleep, appetite, digestion, anything really to be affected by this. Now, there are various forms of depression, so the signs and symptoms of depression can vary depending on the type or severity of depression. However, in general, the majority of these forms of depression all come with feelings of sadness, despair, emptiness, anxiety, anger, mood swings, insomnia or oversleeping, feelings of unwarranted guilt, overeating or loss of appetite, sort of unexplainable aches and pains. The effects of depression on the brain's biochemistry results in an erratic emotional state as well as a host of physical problems. So, because, again, this is your brain's emotional control center and it's totally thrown out of homeostasis, it's very hard for your brain to properly transmit signals, properly interpret signals. So things can easily be misinterpreted by your brain, and you could find yourself getting irrationally angry for seemingly no reason. So that's why depression can be a very dangerous mental condition in that sense. However, the thing with these signs and symptoms is that they aren't always immediately recognizable because some individuals have lived with depression for such a long time that they're so good at hiding their symptoms that you can't always tell that they have it. It would take a very highly trained professional to really even recognize these symptoms, so we all need to really take care to try and look out for our own personal mental well-being. Depression, too, besides the signs and symptoms, depression can have a lot of complications that can be easier to spot. The easiest, obviously, being self-mutilation, such as cutting. More lethal complications, obviously, is if the depression gets too severe, an individual may contemplate or successfully attempt suicide. So As said before, there are various types of depression. While they have many similarities, especially in the symptoms, there are key differences in all of them, such as the root causes or the individuals they affect. You have major depressive disorder, postpartum depression, seasonal affective disorder, persistent depressive disorder, also known as dysthymia, and bipolar disorder. The different types of depression may also require different treatments. So, treatments for depression are sort of twofold. The first step involves treating the condition itself, treating the depression and what it's doing and has done. And then the second involves treating any associated symptoms that aren't necessarily directly caused by depression itself. So, for associated symptoms, this is typically done with pharmaceuticals. Depression and its homeostasis wrecking attitude have a habit of throwing all sorts of things out of whack. They can give you headaches, for example, so your doctor may give you Advil. Depression causes all sorts of aches and pains, so you may need to take acetaminophen, Tylenol, etc. for that sort of stuff. But mainly, we're going to focus on the first step, which is involving treating the condition, and that is done with one of three methods typically: psychoeducation, psychotherapy, or pharmacotherapy. Psychoeducation involves teaching the individual strategies to help mitigate issues as they come up, work through new ones that present themselves, educating yourself in a way so that you can avoid these stressful situations, so that you know when to take yourself out. Whereas psychotherapy involves actively helping an issue or helping an individual work through a given issue or a series of issues that they are currently experiencing now. Pharmacotherapy is similar in some ways to these. You obviously do still have to communicate with the patient, but relies a lot more on the pharmaceutical aspect, giving people SSRIs if they have low serotonin, for instance, giving them, if they are very anxious, giving them more gamma aminobutyric acid supplements to sort of help with those symptoms.